think that things seem to have become very complicated since the halcyon days, those early days of our National Health Service. And my job today, along with my colleagues in the media, is to try and make sense of what is happening and simplify some of the key issues. I guess I could simplify it thus, if you'll permit me. When the NHS was first formed in 1948, the average life expectancy for a British citizen was around 67. It's now around 81. UK population in 1948 was around 50 million. It's approaching 70 million now, and in fact is expected to reach 80 million within the next 30 years. How well have we prepared for this? Well, of course, the answer is very badly. Our expectation of care quality has risen exponentially, the cost of providing healthcare likewise. And while I'm sure we could argue for some time about why, we'll probably agree there is significant pressure on staffing numbers across Lincolnshire in the health service. There are also growing demands upon them for reasons which are well understood, so that seems an appropriate place to begin this debate. And I'll start by introducing the panel to my right, who will each give a 5 or so minute summary of their particular interest in this area. Actually, before I do that, can I just give you some explanation of who these people are here, in case you don't know. We have some members of the CQC team, the Care Quality Commission, as you probably know, recently did an inspection of health services in the county, particularly hospital services. And we have some of the panel here now. Carolyn Jenkinson, Head of Hospital Inspections, Michelle Hurst, Primary Care Inspector, Vicky Wells, Head of GP Inspections for the region. We have also various luminaries from the health services in the county. Tracy Pilcher, who is Chief Nurse from Lincolnshire East Clinical Commissioning Group. Mark Brassington, Chief Operating Officer for ULHT. And Sarah Jane Mills, who is the Chief Operating Officer for Lincolnshire West Clinical Commissioning Group. So introductions done there. If I may start then by introducing you to John Turner, who is currently the Chief Officer for both NHS South Lincolnshire CCG and NHS South West Lincolnshire CCG, and since March 17 has also been the Senior Executive with lead responsibility for the Lincolnshire STP. You hear this abbreviation a lot, both in the media and in the health service. Sustainability, transformation, and I've just been told it's now been changed to partnership from plan. But basically, it's big changes that the health service want to introduce, or feel they have to introduce, into health services in the county. So it matters a lot. So if I could start with John Turner.
Good morning, everyone. Thanks, colleagues at Healthwatch, for me for organising this morning. I'm really looking forward to the discussion and the questions and seeing where this will take us. Hopefully we'll have a great conversation, and it might be something that we'll want to repeat going forwards as well. As Rod said, I'm John Turner, so I'll lead this thing called the STP for Lincolnshire. In simple terms, it's just a plan and our planning for the future of the NHS and the county. And forget the acronyms. We all want the NHS to work well for us today. We've got to make sure it works well and is fit for the future, for us all in the future as well. So that's simply what the STP is about. Just a few words about the NHS as a whole. The NHS is ours. It's all of ours. It certainly does not belong to NHS bosses. It's ours. We're taxpayers. I think we're all very grateful for the services of the NHS. Certainly I am for what it's done for me and my family and my friends, and continues to, and I'm sure you've all had your own experiences of how the NHS has helped you. Vast range of experiences we'll have had in the room of the NHS. If we've got friends or family perhaps with dementia or Parkinson's, who've had cancer, depression, who've had unwell babies, who've had coronary artery bypass grafts. It's massive, isn't it? It's absolutely massive. The NHS, I think, is written at its best, although we all know we don't always get it right. the NHS all the time. The NHS was 70 yesterday, and I had a few statistics. Roger stole a few of these, I think. But just over the past wee while, the life expectancy in the past 35 years for men has gone from 71 to 79, and for women from 77 to 83. Stroke's been down 19% since 1990. Teenage pregnancy down by 60% since 1998. We've got the lowest smoking rates ever at the moment. Suicide rates at the lowest point as well. So there's a huge amount of really good stuff going on in terms of the health of the population as well as within the NHS itself. And when you think about the NHS as a whole, I just think how sort of pretty special it is. But it's always been changing and evolving to meet the ever-changing needs of the people that are here to serve. So we've done a lot of thinking about the NHS and where we want to go with it in the county going forward, and we're continuing to do a lot of thinking. So today, from my end, is just really sharing with you what's in our minds, what's happening, what's going to be happening next, and taking your views, questions and advice on all of that. When I look at the NHS in Lincolnshire, firstly, it's vast. There are 750,000 of us living in the county. If you or a member of your family had an NHS service today, you'd be one of 10,000 people. It's my notes, I just need to put my Poundland glasses on for a moment. Right, okay, we've got 12,500 directly employed staff working in the NHS, directly employed, and then there's probably another 2,000 or so others who work in GP surgeries, dentists, EMAS, so on and so forth. We spend about 1.2 billion, or I'm going to correct that, we have a budget of 1.2 billion to spend on healthcare for the population of the county. Unfortunately, at the moment, we're spending more than that, and I'll come back to that in a moment. About 9 out of 10 contacts we have with the NHS are with our GP surgery. I think for most people, most of the time, the NHS is the local GP surgery and the people who work in and around that. We have a vast range of community staff, community hospitals, mental health staff, we have the ambulance service, and we have our 3 main hospitals, of course, and all of the specialist staff who work there for us. Also, the NHS is about our partnership with others. That might be social care, it might be housing, certainly the third sector, so to speak, like Macmillan, it's the hospices, it's the carers associations, so on and so forth. So there's a lot of it in the NHS. And whilst there's a huge amount that does work well, and we're very proud of, all in our NHS is not well. It's not well here in the county, and as you'll have observed from the national media over the last week while, it's not well across the country either. So we've got a responsibility to try and address the problems we've got and make sure that the NHS can serve the population as well in the future as it has in the past. And when I think about some of the issues that we're facing day in, day out, they essentially boil down to 3 things. Firstly, the quality of care and the outcomes for patients of their engagement with the NHS is not consistently good and as high quality as we'd want it to be. There are certainly many aspects of our health service that compare very well nationally. But we have some real issues in quality of care. You know that ULHT have been struggling with the quality and special measures in some of their aspects of their services. They've had a really great report this week in terms of how much progress they've made on that recently, but it's still very, very difficult. Our A&E services, patients going through our A&E services do not receive the quality of care and the speed of response that we would wish them to. Some of our cancer services, the performance, in terms of how quickly we're able to respond to the population, are not as good as we need them to be. So some of our dementia services again. So there's quite a long list of services that we are struggling with, or we know, this time next year or the year after, if we don't address, we will struggle more with. And you see some of that sort of manifesting itself, like the issues we have at Grantham A&E, like the issues we have at Pilgrim in terms of children's services. It's very worrying. So firstly about quality of care and outcomes for patients. Secondly, staffing. We really struggle to recruit and retain. It's actually more recruit staff to work in the NHS in the county, particularly the more specialist staff. And again, we're not alone in England in having that concern. And it's not just in our hospital sector, it's across the whole of our sector, some of our GP services and others as well. And without the staff, we haven't got the NHS. So it's clearly a worry as well. And thirdly, we're actually spending about 10% more than our budget at the moment. So the quality of care isn't consistently good. We can't always get the staff we need, and we're spending more money than the taxpayer gives us. So these are kind of the three key reasons why we'd want to change anything. In 2016, there was quite a lot of public engagement around all of the issues we face. The public then talked to us about the real challenges of geography in the county, the dispersal of our population, travel times, getting around, and also there were a lot of concerns about levels of deprivation, rural deprivation in our county, and that's a particular concern the more out towards the coast that you go. And there are three real themes that came out of a lot of that. Firstly, we want our hospitals to be great. But we'd like to have more care delivered locally in our communities, through our GP surgeries, our community hospitals and so on, so that we only go to hospital when it's absolutely necessary to do so. And there's lots of really great examples, some in Lincolnshire and some outside, of how we can do more, provide more services more locally to people. The second thing is that our services are too fragmented and we want them to be integrated. So this is patients saying, why do I have to give the same information to different professionals all the time? Why can't the electronic patient record be used differently? And there's also issues about can we integrate more with social care to provide better packages of care to people as a whole. And thirdly, the health service is too reactive and isn't proactive in helping people manage their health care. Somebody said to me recently, if I have an acute emergency situation, I want to go to somewhere where I know I will get the best prospects of coming out and completely recovered. But if I have a long-term condition like diabetes or asthma, I want the health service to work with me to help me manage that condition as best as possible. Thank you, nearly there. We also talked about our population getting older, the over 65s, the over 75s. It's a brilliant success story for the country, for the NHS. But so many people, that's not just solely confined to those age categories at all, now are living with chronic conditions, with diabetes, with asthma, dementia, and so on. And many are living with more than one of these at the same time. And this is where the real increased demand of health service is coming from. So in December 16, we published the plan, the Sustainability and Transformation Plan, call it the plan, following a lot of thinking, a lot of listening, and we put forward a range of issues to address a range of solutions to address the three problems about quality, staffing and money, and to address our three reflections, which is about more local, more integrated and more proactive care. And the proposals that we published there, many of them have been actioned or are being actioned and taken forward. So our neighbourhood team initiative, which is all about trying to solve those issues in local community services. There's some great stuff happening in some of our neighbourhood teams now. And I'm hearing great stories about how they are starting to support people in a proactive, integrated way in local communities, particularly frail elderly people or people we know have particular conditions and concerns that if we didn't support them differently, they would inevitably end up in hospital care. We've done some good work on particularly GP recruitment. The local medical committees done some fantastic work in terms of international recruitment. We're leading the way for England on that. And we now have more GPs in the county from an international background serving people locally as a result of that work. More to be done. In mental health, there's some spectacular work going on. We've also since then got the medical school announcement, and we're setting up an institute for rural healthcare in the county as well, all of which is trying to help us address these issues. Now, last December, we came to the view that despite all of that work, it really wasn't ambitious enough, and we'd missed something. And what we had missed is actually looking at the configuration of what we call acute hospital services in the county and how they need to change and develop to best meet the needs in the future. It's not just about ULHT services, so it's about Peterborough, and it's about Grimsby and Scunthorpe as well, who serve large numbers of the Lincolnshire population. And we're now doing a piece of work that we're looking at what the right configuration of our acute hospital services should be in the future. We've taken a lot of advice from our lead clinicians and from experts elsewhere. That work is all progressing through at the moment. And you may have seen in the media, a lot of people saying, where are we with that work, and can we hurry up and publish all of that? The work internally will be completed over the next couple of months. But because we're anticipating some significant changes, we do have to have all of that assured by NHS England. We will be looking for quite a lot of additional capital, so that's to invest in our buildings. You look at the quality of our estate. I mean, it's pretty ropey in lots of places, isn't it? We want to try to do something about that as well. So it's frustrating for me, it's frustrating for all of us, that it's going to be a little while yet until we're able to come out to the public with what the plan is around the acute services. I want it to be as soon as possible, because that's, and then we can have the discussion and the engagement, talk about what our plans are, rather than speculate about it. We are duty bound to listen to what the public say in relation to all of that. So I anticipate, rather than finish now, there will be a full public consultation exercise on that during the course of next year. We will have to make some decisions about where we go with our services, having heard what the public have to say, and that will all take place during the next calendar year. Thank you. Forgive me for taking longer than 5 minutes.
All right, John, thanks very much indeed. Now, call now on Andrew Morgan, who is the Chief Executive of Lincolnshire Community Health Services NHS Trust. Andrew.
Thank you very much. Can you hear me if I speak at that tone? Is that okay at the back? People are nodding. Excellent, right, thank you. I've just got a couple of minutes just to talk about the services that we provide. Clue is in the name, it's a community trust, and you'll have seen from my biography that I've worked for the NHS for 36 years. So like you, I love it dearly, undoubtedly the best bit of our society. And I was delighted to be at Westminster Abbey yesterday to celebrate its 70th birthday. So our whole purpose in life is about great care close to home. We want to keep people safe and well in their own homes wherever possible. And that involves us working with patients themselves, with health professionals, social care, voluntary sector, anyone in fact who can help us to keep people living as normal a life and as good a life as possible. So the sorts of services we provide are community nursing and therapy services. So you'll be aware of things like district nursing, physio, OTs, speech and language, podiatry, a range of specialist nurses like cardiac, diabetes. I'm going to miss some of them out, which always causes offence to somebody, but I haven't got all day to list all of those sort of adult community services. We provide services for children and young people. So again, they will be child therapy services, physio, OT, speech and language, We provide vaccination and immunisation services. We are no longer the provider of health visiting and school nursing. That was taken back directly by the County Council. We provide beds at the 4 community hospitals that many of you will know and love. So Gainsborough, Spalding, Skegness and Louth, so that those community beds are provided by my trust. We provide end-of-life care, so palliative care, Macmillan services. We also provide services over at Butterfly Hospice in Boston. We provide the integrated sexual health service for Lincolnshire. So that's in all 4 corners of our patch. We're also the providers of urgent care. So GP out-of-hours services, for example, are provided by our trust. And I'll just remind people there are more out-of-hours hours in a week than there are in-hours hours in a week. So you can see the scale of that service. And we also provide all the urgent care centres, again, at our community hospitals. But also, and our busiest centre is down in Peterborough. We provide the minor illness and injury unit in Peterborough City Centre. And a service many of you may not be aware of is the Electronic Assistive Technology Service, which by its very name is very technological. But as I often say to people, if you think of Stephen Hawking and all of the equipment he needed to be able to live his life as normally as possible, we provide that service in Lincolnshire, but also across the region. So in effect, our services are about people's homes, they're about clinics, if it's not appropriate to be in people's homes, they're about community hospitals, clinics and home is not appropriate, but it's also about things like telephone advice. We provide the clinical assessment service, which deals with tens of thousands of calls every year, and does help people to, as I say, live as normal a life as possible without having to visit any other facility. So clues in the name, lots of challenges and opportunities like everyone else. But if you look at national policy, increasingly it is about how do we move care close to home. So in effect, a colleague on my left, Jan from the Acute Trust, I want to help him with his workload. I'll stop. On time.
Thank you very much.
Okay.
May I now call Dr. Jeremy Phipps, who represents the Lincolnshire Local Medical Committee, GPs essentially.
Morning. Thank you for inviting me. I'm Jeremy Phipps. I'm a GP in Market Deeping. For those who don't know where it is, it's quite easy to find. You go on the A15, when you go south, when you're about to run out of Lincolnshire, that's where we are. Which I'm quite pleased to be there because it's, I'm actually from this area. I'm not a true yellow belly, I'm afraid. But it's my mother's birthday. And so after this, she lives locally, I'm going to take her out for tea. What's up, well? I represent 9% of patient contacts in primary care. We have a particular problem with GP recruitment and retention. Across the UK, 40% of GPs are planning to retire in the next 5 years, and 25% of practice nurses. Lincolnshire actually is worse than this. We have major problems, particularly in East Lincolnshire. Problems have been going on really for some time, particularly over the last 10 years. And in April 2016, NHS England eventually realised there was a problem and produced a document called the GP Forward View. I'm afraid many of us thought of this as too little too late. Part of its remit was that we would recruit 10,000 extra staff into primary care by 2021. And 5,000 of those 5,000 more GPs. In fact, in the first 2 years since then, we've actually lost 1,000 GPs. So now we need to get another 6,000 GPs in the next 3 years. One of the other challenges is actually GPs are quite good at their job. We're actually getting people to live longer. greater life expectancy, greater expectancy of the service. We're spending more time in prevention. It means that more of us are living longer with more complex and multiple diseases. This is against a falling number of GPs. The STP wants to improve services by transferring care from hospitals to the community, and we welcome that. We welcome the challenge of that. We welcome being able to provide better service for patients closer to their home. But we need to get more staffing beforehand to be there to have the patients to be able to look after them when they arrive. I don't need to tell you there's been a deterioration in access to GPs across the county. Not at all. I'm actually a bit of the outsider here because the LMC represents GPs, and we take our role as a patient advocate very seriously. Like most GPs, I'm actually self-employed. Not employed by the United Lincolnshire Hospitals Trust, not employed by the CCG. And the LMC is consulted on health plans like the STP, but they don't have a great deal of input. So we're separate, which means we can and do criticise the STP and the plans, and we're free to do so. And we're free to defend general practice and primary care in general. It was a major crisis. And as Simon Stevens, who's the NHS Chief Executive, said, if general practice fails, the NHS fails. Thank you.
I'd like now to call Jan Sobieraj to the stand. Jan is the Chief Executive Officer for United Lincolnshire Hospitals Trust. Yeah.
Okay, I love working with Ron because you can say my surname. Just checking, can you hear me at the back okay? Yeah, so I'm Jan. I am responsible for the trust that was formed in the year 2000. It's been going 18 years. It provides hospital care across three main sites of Grantham, Philbrook, Boston and Lincoln. We also provide care in Louth, more limited range of services and outpatient services in Gainsborough, Skegness and Spalding, and some other places. I like to attend all of our staff inductions. I've done a couple in the last few weeks. And we always show our staff a fantastic video in memory of Kate Granger called 1,000 Days, which I highly recommend. It's a very moving, sort of 3 or 4 minute video. And in it, it says, for many of our older patients, they only sadly have around 1,000 days of life left. How many of those do they want to spend in hospital? The answer is clearly none. So our job, when we tell our staff on day one, is to make sure that the majority of our patients, our job is to get them home safely, back to where they belong, not in hospital. And that's our main task. 90% of our around 1,000 beds are designed to look after emergency patients. So only 10% of planned patients. That's broadly what we do as an organisation. So we are a fairly big organisation, one of the biggest DGHs in the country, but we spend less than 40% of the total budget the NHS spends in Lincolnshire, 1.2 billion that John described. So we have high volumes, the majority is around outpatients, 600,000, a lot of diagnostic tests, 160,000 A&E, attendances across our sites, about 71,000 inpatients, planned operations, and about 60,000 emergency care admissions. So our focus is to look after our patients and get them back. We do, of course, look after people with chronic conditions, and we do that much more in collaboration, as Andrew's described. So for diabetes, heart disease, rheumatology, prescription care, we have a lot of patients who are frequent visitors, and we look after them mainly for outpatient settings. Occasionally they come into our inpatient wards. We have a limited range of specialist care, so we do provide some special care, and there's a separate system outside the CCGs organised in the NHS, which I know complicates lots of things, run by NHS England, that commissions specialist services, like neonatal services, for example, are commissioned by NHS England. Vascular services the same, and we work with those to provide that care. But a lot of specialist services are managed in conjunction with our neighbours, particularly in Nottingham and Leicester. So we have networks. So if you come in for very specialist care for cancer, we'll do what we can, but we know our limitations and we'll pass that patient on through our networks to be looked after in conjunction with our colleagues elsewhere. And that's, for example, trauma. So we're not a major trauma centre in Lincolnshire. If you're major trauma, you will go out of our county into like Nottingham. And we have a number of other networks, for example, urology, where we work very closely with our colleagues in Leicester. The last thing I want to say is just a warm rod, and I'll finish in a second, is that our focus on life is to absolutely support our colleagues in primary care, in mental health services and community services, because we know most people do not want to come to hospital. It's not as safe as you think it is, and we are absolutely focused on working with our colleagues as I've described to make sure patients can find better ways to be looked after in the hospital. If they do need our care, we get them back out as fast as possible with their support. Thank you.
No, thanks very much indeed. And finally, Dr. John Brewin, who's the Chief Executive of the Lincolnshire Partnership NHS Foundation Trust. I say finally, last, but certainly not least, thank goodness, mental health is now getting the reputation that it deserves. John.
Thank you. Morning everybody, thank you for the invite. I hope you can hear me okay. I can sense in the room you're all gagging to ask questions, so I will be brief. There's three things I want you to remember about the Mental Health and Disability Trust, which is a county-wide service. We are rated good by the CQC, the Care Quality Commission. We are not complacent and we want to get better every day. And one of the key parts of the STP for us is about broadening the access to people with mental health and related conditions. And by that I mean, it's all very well being a specialist mental health and disability trust, but as Jeremy said, 90% of all care goes on in primary care. And there are lots of people in primary care that don't get the mental health expertise they need. That's not a criticism of them, it's the way services have been set up. There's lots of people in Andrew's and Jan's trusts that have mental health conditions that are either not diagnosed, not seen, don't get the right treatment they deserve. And one of the real opportunities of the STP is to enable the change in service for all these people that are not getting the right services to get them for the future. One of the key things that we're doing within the Lincolnshire Partnership is looking at some of our really traditional services. So we've got some quite traditional outpatient services where people come, you wait, it takes ages, you see the doctor or the nurse for a few minutes and then you changes. And we want to transform that both for our adult services and for our older age services so that we can focus on our purpose, and our purpose is to enable people to live well in their communities. And we want to wrap a mental health and learning disability offer into neighbourhood teams, into localities to support people, patients, their carers, families to, as Jan said, stay out of hospital wherever possible. Where people do need to come into hospital, we want the best facilities and the best environments for them. The STP offers an opportunity for us to access money to build new buildings. We've got some great plans. We've already opened an intensive care unit for people with mental illness that reduces their need to go out of county, which is a major national priority to reduce people having to travel all over the